CDC calls it an epidemic. The Human Papilloma Virus, or HPV, is a group of more than 150 related infectious viruses, some of which can lead to cancer.
In fact, HPV-associated cancers are on the rise. The HPV vaccine is currently available, but despite a growing number of young people being vaccinated, the rates are still not as high as health experts would like. And that has Upper Chesapeake Health creating a new initiative to help. WMAR2 News' Ashley James has more tonight.
Harford County mom Claudine Ripertella is a cancer survivor herself, so getting her kids vaccinated for HPV was a no-brainer.
I thought if there's a vaccine out there that could maybe stop a certain cancer down the road for my kids, because there's so many other, things that could happen, I didn't really hesitate at all because of that reason.
The HPV vaccine is the first cancer prevention vaccination. Dr. Paul LaMonaco, a pediatrician, says it can be given to both male and females, typically starting around age 11.
We usually give it to boys up until around 21 years old, girls up until 26 years old. Even if they have an HPV strain that could be cancer-related, there are 6, 7 different strains that are related to cancer, so they can still get the vaccine. In fact, we would definitely encourage it.
Dr. LaMonaco says while more families are choosing to vaccinate their children for HPV, the numbers are still not high enough.
The biggest problem the CDC sees is that while the vaccination rate is going up, the incidence of HPV-related cancers is really going up.
Vicki Bands is the director of community outreach with the University of Maryland Upper Chesapeake Health. She says in Harford County, vaccination rates for HPV are currently only about 33%.
It's not a required vaccine yet for school, which is really part of the problem.
Upper Chesapeake Health is focusing on a countywide initiative to get those numbers up. One way is by increasing awareness and educating parents and students.
We really had to bring the school system to the table. So we work closely with Harford County Public School, particularly their supervisor of nurses. Parents are very trusting of their school nurses. So what the school nurses have to say and what their opinions might be is really very important. And they do a lot of education to both the parents and the kids.
Together with the community, the goal of Upper Chesapeake Health is to have 80% of eligible children in Harford County vaccinated by age 18 before 2020.
That was WMAR2 News' Ashley James reporting. Fewer adolescents in rural areas compared with youth in urban neighborhoods are getting the HPV vaccine. So parents, if you have questions or concern, contact your pediatrician. Insurance will cover the cost of the vaccine.